Today, we're honored to welcome a true leader in the field of veterinary pharmacovigilance and mentorship, Dr. Derrick Medley. As a veterinary manager of global pharmacovigilance and Boehringer Ingelheim, Dr. Medley is not only driving safety in animal health, but is a local advocate for diversity, education, and innovation in veterinary medicine. He's inspired students, empowered colleagues, and represented the kind of leadership that our industry needs. Welcome, Dr. Medley.
Thank you. Thank you so much, Ryan. Thank you for that introduction.
Yes, I'm so excited that you decided to come on and have this conversation with us, a much needed conversation.
Sure. And thanks for having me.
Of course, of course. Let's jump into the questions. Can you break down what pharmacovigilance means in the veterinary space and how your work at Boehringer Ingelheim impacts animal and public health?
Sure thing. Breaking down pharmacovigilance, let's look at the word. We can break it down just right there. Pharmacovigilance, being vigilant about pharmaceuticals, and moreover, really more specifically, being vigilant about the safety and efficacy of pharmaceuticals. Part of what I do and other pharmacovigilance experts and what we do is actually we try to make sure that the drugs or the pharmaceuticals that are on the market are safe and effective for the subjects they're used for. How this affects veterinary medicine and public health. Of course, for veterinary medicine, I'm actually a veterinarian that's doing pharmacovigilance in the animal health sector. So we're trying to ensure we make sure that the medications that are out there are safe and effective for our fur babies and fur buddies that are using it. That affects it alone, you know, from the companion animal standpoint. People are becoming more and more they commingle more and more with their pets, and they're looking at them more and more as family. So you want to make sure that we're doing no harm from a large animal or food animal standpoint. Again, that filters into the public health sector, in that you want to ensure that food animals, animals that are eventually going to go to market, like beef, cattle, poultry, and swine, that any pharmaceuticals that are used for them are going to not only be safe for that particular animal, but that there won't be any residuals that will affect humans. So, so the two meet, as far as veterinary medicine and public health, they meet quite a bit. Of course, with the companion animal, there's the human-animal bond, but lest we not forget that some infectious diseases are zoonotic, and so hence the reason for some of the medications or vaccines is not only to prevent the animal from becoming sick, but also to prevent them from passing it to a human. So that's how we actually look at both in pharmacovigilance.
What are some misconceptions people have about drug safety in veterinary medicine?
I would say misconceptions people have about drug safety in human and veterinary medicine is that all medications are safe. Medications, be they over the counter or prescription only, they go through trial studies for sure. But with those trial studies, they have a set number of subjects in the studies. You have a certain amount that you look at and a certain amount of time that you look at for safety and efficacy. But once it goes to market, be it over the counter or prescription, you're going to reach a much broader audience or much bigger market. And sometimes we don't, as people that are become so accustomed to how well these drugs are actually formulated and monitored, we don't take into account that actually there can be some side effects. All pharmaceuticals come with side effects, even if we pick them up from our local pharmacy over the counter. And a lot of times, myself included, we don't read the back of the label. We don't always read the box to see what's there. So one of the misconceptions is, hey, if I got it from my veterinarian or if I got it over the counter, it must be safe. And for what it is. But with all safety studies and all clinical trials, there are some limitations to the safety. There are some areas that there are some side effects. And then also, too, we take into account that what may not be seen in clinical trials on a bigger level you may see some things that may not have been seen in clinical trials. And when that happens, that's where pharmacovigilance really takes a role there to make sure we're reporting these side effects or adverse events to regulatory agencies, which can result in actually a revision to the label, a post-approval to the.
That's such an important job.
Yeah, thank you.
Have there been any red flag cases or studies or industry wake-up calls that reshaped how companies approach pharmacovigilance?
That's a great question. And one of the reasons why pharmacovigilance is so important is one of the most known kind of case or red flag case, as you put it, in history that actually helped to shape how regulatory agencies look at the safety of products. With this, I'm going to go back in history, actually, and this is dealing with human medicine. In the 1950s, there was a medication, the active ingredient called thalidomide, that was actually formulated and used in Europe, approved in Europe to use in pregnant women for nausea, for morning sickness. And it was used pretty heavily there. And but it was not approved in the United States. It was actually blocked by one pharmacologist and physician. Her name was Frances Oldham Kelsey. She was a Canadian American pharmacologist and physician. And she saw some things in the clinical trials, as I mentioned before, that just didn't kind of sit right with her. She didn't think it would be a good idea to have that drug actually marketed and sold in the United States. So it was blocked by the FDA. And good thing that it was, because the women that were taking it for nausea or morning sickness in Europe, it resulted in birth defects, and a lot of birth defects. Actually, when I say a lot in the number of subjects that were affected by it, but anywhere from deformed extremities, problems with the digestive tract. There was problems with the cardiovascular system, neurological system, really heavy hitting side effects. And some of these recipients of those side effects are still living today. Some of them actually are still living with some of those abnormalities today because of that particular product. After that happened, the thalidomide was banned and used for women for pregnancy in 1961 because of that. And so it gave regulatory agencies, it gave them the green light to take a deeper look into how seriously we want to take looking at new products and new drugs, because it was a travesty in itself. But imagine had it made it over to the United States, it would have been even more victims to this. So with that being said, it kind of shine a light on that, hey, we need to look at how do we regulate new products and new drugs to make sure that we're ensuring the safety of the subjects that are using it and their potential offspring.
Oh my gosh. Wow. Have you ever run into a situation where you felt like you had to fight for something not to go to production?
I can't say that I've ever seen a situation where I've fought for something not to go to production. I can say that, when we, as pharmacovigilance veterinarians and experts, when we see certain adverse events, we are obligated, when we report them to regulatory agencies, to determine or to give our expertise as whether this is a serious event or not. And then we do have checks and balances to look and see if there's an uptick on adverse events or side effects that we have not expected based on the labeled expectations or clinical trials. I have seen in my career in industry, in pharmaceutical industry, I have seen where sometimes you have to go back to the basis and look at the manufacturing and see, not for serious side effects, to see, hey, if there's an uptick, say in something like, and this is hypothetical, something like, hey, if vaccine is used, it's more stinging or more constant. That you go back and look and see, has there been any changes? And I think this across the board, not just with my company, but in pharmaceutical industry in general. Whenever there's an uptick in adverse events that are not expected, not on the label, you do an internal investigation, or at least you should. And sometimes
Yeah.
you can identify, hey, something may have changed. It may have been, hey, some of the raw materials that you're using may have changed manufacturers. It could be anything really. And again, it's hypothetical, but it gives you an opportunity to try to navigate and mitigate any future issues or problems if you're seeing an uptick before you even get any type of notification from regulatory agencies.
It's comforting to know that people like you and companies like Boehringer Ingelheim are the ones in charge of this, because you guys do a really good job at making sure to provide the very best quality across the board. So I have a lot of respect for what you and your company does. So thank you for what you do.
Well, thank you for that compliment.
Yeah, it's needed. Little bit of a pivot. You've supported diversity scholarships and spoken at Tuskegee. Why is representation in veterinary medicine so critical right now?
I think representation in veterinary medicine is not just critical right now. It always has been. I actually think we've made a lot of inroads in veterinary medicine as far as increasing representation and diversity of those underrepresented groups. When I came along, and I am a Tuskegee graduate, I graduated from Tuskegee College of Veterinary Medicine in the late 90s. But when I was coming along back in the day, kind of aging myself, I didn't have a lot of mentorship to guide me towards veterinary medicine. As a matter of fact, I didn't have any, but I always knew I wanted to be a veterinarian. And so I forged ahead, and I did what I needed to do as far as taking courses, making contacts. I had to be an advocate for myself. But even then, and that's not been that long ago. Again, I graduated in the late 90s. Even then, at that time, I think there were 27 veterinary schools in the United States. I think we're over 30 now. I think there's 35, but there's not a lot compared to schools for human medicine. So there's a lot of competition to get into these schools. But back then, there were a lot of schools that if they had one person of color, that was their one person of color. They didn't have a lot of diversity in their schools. Tuskegee has been historically the school that has graduated the majority of minorities over the years. Tuskegee Vet School, the first graduating class was in 1949. I think one misconception about Tuskegee is that the veterinary school, I think people believe because it's a historically Black college and university, they believe that the veterinary school is only represented of African Americans or people of African American descent. However, Tuskegee is the model representation of diversity in veterinary medicine, because even in my class alone, other classes, we have a large percentage of Caucasian students, Puerto Rican, Caribbean students, and students from India. We really have a gamut. It's like a melting pot. So it is very, very diverse, although it is very notorious for graduating the most amount of higher percentage of African-American veterinarians. There have been many people of other cultures and races that have graduated from Tuskegee. And it only helps to shape and build you not only as a veterinarian, as a professional, but as a person, because when you get out there in the workforce, you're going to work with all types of people of different cultures, different backgrounds, and things of that nature. And what collectively you bring to the table actually can only improve and help veterinary medicine.
I agree with that 100%. There's a statistic. I did the Purdue's DEI class, and I don't remember it, so I may be misquoting it here, but the percentage of diversity directly correlated with the success of the hospital. And I don't know the number, so I'm not going to go quoting.
I believe that. I believe that because, again, the world is changing. The world has been changing, and it is a very diverse world out there. And when you have people that bring pets in and they can see themselves in you, that makes them more comfortable, that makes them more compliant, and that makes them more loyal to that clinic. I'm speaking for myself as as a Black man. And even when I got out of veterinary school, I felt it very important to become a mentor, and I still do, obviously, with your question there, so that other people that look like me, especially young Black boys and Black men, see that they can do it. Because as I mentioned earlier, when I started, I didn't have that mentorship. I really didn't have a veterinarian that I can pattern myself after. I just had a goal in my mind. I had determination, and I forged ahead. But by the same token, if you're a person that's Spanish speaking, and you go to a veterinary clinic and you see someone of your culture or speaks your language there, it makes you more comfortable. I'm not bilingual, unfortunately. I can muddle through some words, but it makes it much easier for a person who speaks Spanish, for instance, to have a veterinarian there that not only understands their language, a little bit about their culture. So I think there's something to be said about the more diverse we are, the stronger we are.
For sure. I think, and one of the gray areas is that the animal field, especially in the hospital, when we're dealing with stressful or heart situations where people are worried about their pets, which is why they come in, it's always good to have someone to relate to.
Sure, for sure.
Yeah. If you could change one thing about how veterinary education is delivered, what would it be?
If I could change one thing about how veterinary education is delivered, one thing I will say, and this may be hopefully not too controversial, but I will say when I was in veterinary school, when it came time to do surgeries and learn and perform surgeries, we did them on live subjects, usually from the animal shelters and humane societies, spays and neuters and things of that nature. I know that over the years, due to public outcry and concern about how animals have been treated and that they're being treated humanely, veterinary schools have gone away from live surgeries and instead of substituting different things, banana peel, oranges, cadaver, different things of that nature. If I could change anything, I would say maybe we go back to live surgeries, but we kind of modify it and tweak it where if veterinary students are allowed to go to underserved communities where maybe there's feral animals or animals that are roaming to spay and neuter, but under the supervision not only of professors at the veterinary school, but veterinarians in the community. I've always thought and I've known that the animals are treated humanely. A lot of times when you're outside looking in, it seems like, oh, what are you doing? You guys are using these animals for practice. And that was not the case. They were treated with the most humane, the most humane protocols. And we did everything we would as if this were a person that were coming in paying a lot of money for the same service. So they were treated humane, but I do get the public outcry. I do think that though there's something to be said about, hey, let's go back to live surgery, but let's do it as a community service type of situation so that we're not only learning as students, but we're providing a service to communities so that you cut down on overpopulation, which also cuts down on disease.
Right. Yeah, I understand that. I always thought it would be cool for the animal field to start using AI and 3D printers and things like that and be able to, maybe even cut down on the cadavers that we use and go that route.
It's a great point.
You've worked closely with veterinary scholars and student grant programs. What qualities stand out in the next generation of veterinary professionals?
Oh my goodness. My mind is constantly blown by how far along veterinary medicine has come and how much more advanced some of these students are when I was there. I really do mean that. But some of the students that I've actually worked with veterinary scholars and in mentorship situations, I am so impressed. And I'm not just saying that. There are leaps and bounds ahead of me as far as the material they're studying and how far they're gone. For instance, one of the things that really stands out, there are a lot of students that are really studying things in biomolecular research and things that actually help to shape human medicine and looking at things that may involve zoonosis, which is needed, right? Because we know that's always, zoonotic diseases have always been around. And for those watching that may not be in the veterinary field, zoonotic diseases means that a disease that can be, or something that can be passed from an animal to a human. And so we, case in point, we know that to be, or we think that to be the case with the latest big thing that happened 5 years ago with COVID, the small disease from, that come from avians. And that's not too far off, because we do know that bird flu has been around and it can affect humans, but there's been other things. Ebola, throughout the years, there's been different zoonotic diseases. And a lot of the students are working so far above and beyond just your garden variety general practitioner, which is nothing wrong with that. That's what I strive to be, and that's what I was for a number of years. But they're going so far ahead of that and looking at biomolecular research and reshaping how medicine looks for animals and humans. I'm just so impressed.
Yeah, that's a great point. How do you balance corporate goals with personal passions when speaking to students or mentoring new grads?
Another great question. And that really is a great question, because honestly, with my role at Boehringer Ingelheim, I've been afforded and been given the benefit of actually integrating the two things. And it's been a welcome. I mean, it's been really amazing to me how much I've enjoyed that. I've not worked at a company before where, and nothing to other companies I work for, but I've not worked at one before where part of mentoring students was weaved into the fabric of the company. And so I'm able to balance that passion, because I've been afforded that benefit with my company and given the green light and given full support to mentor and to have these passion projects, which really I'm so grateful for, because it really has kind of given me a new lease on life when it comes to veterinary medicine. I've always, as I mentioned, when I graduated veterinary school, I've always thought it important to mentor. And I practiced in the clinic, in small animal clinic. I used to take time to go to the schools anywhere from pre-K up to college and talk to students in the class. I would bring my dogs at the time, the ones I had at the time. And everybody loves a dog, right? A nice puppy or whatever. And that was great to do that. Now, with my role with Boehringer and some of the projects I've been working on, I'm able to speak to students directly that have an interest in animal health without me persuading them to do so. So now it's like the next evolution of things. I'm not persuading them. I'm actually giving them, some maybe historical advice from my aspect, also giving them contacts that I may know, and giving them inroads to how I can help them along the way with their animal health journey.
That's so amazing. And just for the people out there, can they reach out to you for, say, speaking engagements and things like that?
Sure.
Okay, cool.
That's one thing I don't have a problem doing speaking, as they tell me. My friends and family know, and those that may see this, they know I don't have a problem with speaking. I actually rather enjoy it. So sure.
Yeah. Okay. I mean, for everybody out there watching, this is another reason why we do this podcast. And if you need any help, go to this guy. Dr. Medley is going to be there for you. And I mean, he just told you this is something that he loves. So I'm going to be tagging him in all of the posts and clips so you can all see it, in all of the ACT community and family. This is your go-to.
Well, thank you.
Where do you see the future of pharmacovigilance heading in the next 5 to 10 years with AI and tech integration?
You know, with AI and tech integration, I think animal health in general, including pharmacovigilance, there's going to be some changes. I would be the first to admit, I'm so old school. I still kind of struggle with certain programs on the computer. So I haven't caught up to the AI revolution yet. Okay. But I can definitely see how it can change and morph things. Where I see it affecting pharmacovigilance, whenever, again, as I mentioned, part of our role is to look at these pharmaceuticals to make sure they're safe and effective. That comes by actually reviewing reports that are submitted to our company based on our products. If a client is using our product and they see a perceived adverse event, or if they feel that the product didn't work, lack of efficacy, they would call in and report that. And before it reaches the Food and Drug Administration, the United States Department of Agriculture, or the Environmental Protection Agency, it goes through a veterinarian like myself, where we actually look at the bigger picture and we determine what role the product may or the drug may have had in the case itself. If it had a role, we're honest about it. If there were mitigating factors, we provide those things. Where I see this going with AI and tech integration is instead of veterinarians or pet owners calling, I think that with tech integration, there probably would be some type of way to report adverse events electronically and maybe do it more efficiently. Hopefully, that's the goal, is to be more efficient about the reporting and get the content that's needed to assess the case and make sure that we're giving our due diligence to make sure that things are remaining safe and effective.
Yeah, that's a good point. Effective communication. Yeah. What keeps you motivated in a role that's often behind the scenes, but so essential to public trust in veterinary products?
You know, what keeps me motivated is just what we're doing right here. When I graduated veterinary school, pharmacovigilance, I didn't know the word, never even heard of the word. And yet alone working for even pharmaceutical industry, I always wanted to be a small animal practitioner, do the general practitioner, which I did. And I loved it for a while. And industry kind of happened to me, you know, it kind of fell in my lap there and I took a chance on it. And that's been over 21 years ago. And it's been great for me. Even when I started working for pharmaceutical industry, still didn't know about pharmacovigilance, but I learned quickly. I learned about the role. But before having this role in pharmacovigilance, I was a veterinary technical solutions veterinarian. I was the guy you would call if something went awry, and I would walk you through it over the phone, put out any fires, answer any questions, things of that nature to make sure that the pets are safe. But then I learned more about pharmacovigilance, because when those calls came into me, they would eventually end up in the pharmacovigilance sector. Learn more about it, and I've taken on that role, I think, about 7 or 8 years ago. And it's opened up a new world. Actually, not only been having a very critical and discerning eye to look at case by case to see if any of the medications that are being used are playing a role in any unwanted adverse event or any lack of efficacy. And, you know, kind of looking at that, not only providing the information to regulatory agencies, but seeing, oh, hey, if we are seeing that, what can we do? Is there something that can be done about it? So you're still working on the aspect of safety for pets. So that keeps me motivated, because to be honest with you, when I left veterinary medicine in practice and came into industry, one of my biggest trepidations was I wasn't going to be able to see the animals day to day like I did in the clinics. And I love animals. That's kind of why I got into veterinary medicine, and most people do. And so that was a worry for me. And then also a worry for me was one of the things I really enjoyed in the clinics was educating the pet owners about use of products so that their fur babies and fur buddies were safe. And I thought I was going to lose kind of contact with that. With industry in both roles, veterinary technical solutions and pharmacovigilance, what keeps me motivated is I'm still playing a major role in making sure that their fur babies are safe and their fur buddies are safe. And I'm kind of one of the stops along the way that make sure that, hey, we're doing the right thing to make sure that the products we issue are safe and effective.
Such an important role. Such an important role. What's one innovation in animal health you believe the public or vet clinics are sleeping on and needs more spotlight?
One innovation that may need more spotlight. I don't know if this innovation exists already. It may actually, and it may not. I haven't been in the clinics in a while. But I know that as technology changes and improves and morphs throughout the years, and as generations come up, they're becoming more and more tech savvy, and we as a society are depending more and more on technology. One of the things that I've often thought, even in the past, if there was some type of app or application. You can't go anywhere without a person on their cell phone or their tablet,
Right.
and not to make phone calls, but to go through apps and go through. We're a society now that we like everything at our fingertips. And I know, speaking from my history as a veterinarian in general practice and the history of veterinary medicine in general, where there was a time there was the family veterinarian, just like there was the family doctor or the family pharmacy. And over the years, things have kind of changed somewhat, not in a bad way, but where now you have corporate veterinary practices where they can be franchised throughout the country. And with these, same thing with retail, you got corporate retail shops that may have taken over the family pharmacy or the family boutique. So as things change, we have to change with them. With these corporate veterinary entities, they have more of probably of a buying power to maybe do something like that, an app that's more cohesive that will, if you're at one of their facilities in California or in North Carolina, you can still communicate via the app with the records for the vet. For the private practitioner, that may not be as practical. Right. I don't know how that would be navigated, but I think that it would be helpful for all veterinarians, including the private practitioner, the sole veterinary owner that doesn't have a legion of veterinary clinics, just the one, but he has loyal clients. If there were a way to have some type of digital application that the pet owner could access at their fingertip to look at the medical history, to look at when the next appointment is, to look at, ask questions, to kind of ask them like a teledoc situation, that some questions, of course, with some things that would have to come into the clinic, but some questions may be asked on the application. I think that type of technology would be very useful. And I think that pet owners would respond to it well.
Yeah. I mean, on a smaller scale, just working in emergency, when we have a patient come in at, 1, 2, 3 o'clock in the morning, and they've had this long history, heart failure, Cushing's, renal disease, we have no medical records and we can't get them into the morning anyway. So having that at your fingertips would be super beneficial.
Exactly.
Yeah. That's a great point. That's a good idea.
Thank you. Should I put a patent on it now?
You should. You should. Complete this sentence. The veterinary industry won't survive in the next decade if we don't blank.
Oh, wow. Won't survive. That's pretty heavy. I will say that the veterinary industry, I do think it'll survive the next decade. I do.
Okay.
But if I can reshape that or reword that, won't thrive. Will it? There's a difference between surviving and thriving more than we should. So if I can reshape that, will it thrive as much as it can in the next decade? If I had to say one thing, I would say if we don't embrace diversity, you mentioned, the study that you saw from Purdue University earlier. I think that, in today's climate politically, with diversity being a thing that for some reason is under attack, it seems like we're making steps that are going backwards. And I think it would be a mistake to do so. I think that veterinary medicine will thrive at its best if we embrace diversity. And that's, again, diversity comes in all shapes and forms. It's not just the color of your skin. It's your background. It's your culture. It's your gender. It's a lot of different things that you put in that melting pot that make the perfect recipe. And I think that if we were to embrace that, veterinary medicine would thrive even more than it is now.
Got it. And there you have it. Thank you, Dr. Medley, for coming on and having a conversation with us. The work that you are doing is, I just, when looking up and researching you, that's when I learned about pharmacovigilance as well. But it's such a unique and needed job. And I think it's really cool to be able to hear from a person like yourself and kind of just get a little sneak peek into what's going on.
Well, thank you. And thank you for having me. It's been a pleasure.
Yeah. Well, thank you for your insight, transparency, and leadership. Your impact reaches far beyond the lab or the office. It's clear you're shaping the culture and future of veterinary medicine. We appreciate you and your time and look forward to supporting your work in any way that we can. I am definitely going to be tagging you in all of these things. I already know a couple of hospitals that want to reach out to you and potentially have you come out, even if it's just to kind of talk and hear, and pick your brain in this fashion. I'm going to be blasting this interview out to as many folks in hospitals as we can. This is an important one, and I appreciate you.
Thank you so much. Thank you.
Ladies and gentlemen, this is Ryan from Athletic Conceptual Training. Go watch this video. That's all I have to say.
Thank you, Ryan. You have a great night.
Thank you. You too.
All right. Bye-bye.